Hey everyone, I'm Tanvi Kumawat and I am from Jaipur, Rajasthan, India. And today I'm going to talk about peripheral nerve injuries. So, what do you mean by peripheral nerves? Peripheral nerves are the nerves which are present in the periphery of our body, which includes nerves like ulnar nerve, radial nerve, median nerve, sciatic nerve, and many more. So, in today's topic, we're going to talk about mainly ulnar nerve injury and radial nerve injury. Chances of radial nerve injuries are more common and chances of ulnar nerve injuries are 30%. Rest of the injuries are less common. So what are the causes of ulnar nerve injury? The main causes of ulnar nerve injury are some general causes which includes metabolic diseases, collagen disease and some chemical or mechanical trauma, and some other local causes which includes the causes from the axilla to the hand. So firstly, in the axilla, the main cause due to which ulnar nerve injury can occur is compression due to crutches and aneurysm of the axillary vessels. Now let's come to the arm. In the arm lesion, what are the main causes of ulnar nerve injury? In the arm lesion, there might be fracture of humerus, shaft of the humerus, or some gunshot or penetrating injury. Let's come to the elbow. In the elbow, the main causes of ulnar nerve injury are fracture of lateral epicondyle of humerus, or sprains or compression due to osteophytes, which are mainly seen in osteoarthritis and rheumatoid arthritis, and the fracture of radius and ulna, or some gunshot or penetrating injuries. Now let's come to the wrist. In the wrist region, there might be fracture of hook of hamate or compression due to ganglia, compression due to osteophytes, or some wrist injuries. So these are the causes, and let's come to the hand. In the hand, the ulnar nerve injury might occur due to blunt trauma or any other gunshot or penetrating injuries. So these are the causes of ulnar nerve injuries, local causes of ulnar nerve injuries from axilla to the hand. Now, let's talk about clinical features of ulnar nerve injury. What are the clinical features you will see in a patient of having ulnar nerve injury? You will see there will be muscle wasting, weakness in the muscles supplied by ulnar nerves. Some muscles which are supplied by ulnar nerve are hypothenar muscles of the hand, which includes abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, and some intrinsic muscles of 7 interossei. And these are the muscles which are supplied by ulnar nerves, so they get wasted due to ulnar nerve injury. Now, how do you know or that a person is suffering from ulnar nerve injury? Some clinical tests for it are there. So what are the tests? There are 3 types of tests. First is Foreman's test for ulnar nerve injury. Has asked to make a pinch like this. There will be involvement of 3 muscles in this process. The first one is the abductor pollicis, the second one is flexor pollicis longus, and palmaris interossei. So in ulnar nerve injury, there will be paralysis of 2 of these muscles, the abductor pollicis and the palmar interossei. So if a person having ulnar nerve injury, then he has to depend only on one muscle, and that is flexor pollicis longus. So there will be more flexion in this process in pinching. Alright, so this is the first test, which is known as Foreman's test. Now let's come to the next test. Next test is the cards test. Now let's say I have a card. Let's say this is a card, and let's say I am the examiner, and I have to give this card to the patient, and I will ask him to hold it tight between his little finger and the ring finger, like this, and I will try to pull it out and ask the patient to don't let me pull it out, and this if the patient is unable to do it, then there will be presence of ulnar nerve injury. Now let's talk about the third test, The third test is Igawa test, in which the patient has asked to put his palm on the table like this and ask him to remove this middle finger towards the index finger like this. If the patient is unable to do this, then there will be presence of ulnar nerve injury. So these are some clinical tests for ulnar nerve. So what is the treatment for ulnar nerve injury? Treatment involves tendon transfer, medial epicondylectomy, and anterior transposition of the ulnar nerve. In anterior transposition, the surgeon will lead the ulnar nerve from the posterior side to the anterior side. So there will be surgery. Now let's talk about physiotherapy treatment. We give a knuckle bender splint. Knuckle bender splint. In ulnar nerve injury, most common injury or deformity is claw hand. In claw hand, there will be hyperextension of metacarpophalangeal joint and flexion of interphalangeal joint. So we'll give the patient some splints like knuckle bender splint, which will help in flexing the hyperextended metacarpophalangeal joint and helps in reducing the deformity of claw hand. So, and some exercises are also given like flexion of the metacarpophalangeal joint. Now let's talk about conservative treatment we can give in SAID. These are some conservative treatments, surgical treatments or physiotherapy treatments of the ulnar. Now let's talk about radial nerve injury. So what are the causes of radial nerve injuries? So the causes of radial nerve injuries may be general causes or local causes. Some general causes are the same as ulnar nerve injury. These are metabolic diseases, collagen diseases, some chemical or mechanical trauma, and some local causes includes from the axilla to the forearm. Now, first of all, let's start from the axilla. So, the common cause of radial nerve injury in the axillary region is same as of the ulnar region, which is due to mainly crutch. The crutch provides some pressure over the axilla, which will lead to radial nerve injury. And the second one is aneurysm of axillary vessels. Now let's come to the proximal part of the shoulder. Now the common causes of radial nerve injury in the proximal part of the shoulder is the fracture of proximal shaft of the humerus. Now let's come to arm. It might be due to Saturday night palsy or syringe palsy or due to tourniquet. Tourniquet is a kind of bandage. So due to tight bandaging, radial nerve palsy can occur. Now let's come to the elbow. In the elbow region, the radial nerve can be injured due to the fracture of shaft of humerus, fracture of lateral epicondyli of the humerus, and osteophytes. And let's come to the forearm. In the forearm, it might occur due to some gunshot or penetrating injuries or due to fracture of the radius or ulna. So these are some local causes of radial nerve injury. Now let's talk about clinical features of radial nerve. What are the clinical features of radial nerve injury? So there will be paralysis or there will be weakness of muscles supplied by radial nerve. Now if we talk about the part above the spiral groove of the humerus, then there will be complete paralysis of the muscles supplied by radial nerve. While when we talk about the level below the spiral groove, then there will be weakness in some muscles supplied by radial nerve, like extensors and flexors of forearm. There will be weakness of extensors and flexors of forearm, which includes triceps and brachioradialis. And there will be wrist drop or finger drop due to the paralysis or weakness of extensors of wrist and finger. Feature of the radial nerve injury also includes that the patient will not feel any sensation over the dorsum of his hand. What is the clinical test for radial nerve injury? Hitchhiker's sign is the most common sign which tells that the patient is having radial nerve injury. In Hitchhiker's sign, the patient is unable to extend his thumb due to the paralysis of interphalangeal muscles of the thumb, which are extensor pollicis longus and extensor pollicis brevis. So there will be paralysis or weakness of extensor pollicis brevis and longus both of the thumb. That's why the patient is unable to extend his thumb. So this is the hitchhiker's sign, which is the most important sign to detect that the patient is suffering from radial nerve injury. So now, what is the treatment for radial nerve injury? So now let's talk about the treatment of radial nerve injury. If the radial nerve got injured due to closed fracture, then we'll give pop-up splints to the patients. Pop-up splints are the splints which are used to extend the fingers and the wrist. From firstly, we'll apply the splint for the static process. Afterwards, we'll apply for the dynamic one. After that, we'll give physiotherapy exercises like firstly, we'll guide the patients to do full range of motion actively, and afterwards, we'll guide the patients to actively assist the movement. Afterward, come to the PNF technique. Now, let's come to the open fracture. If the radial nerve is injured due to the open fracture, now what should be the treatment? So, the treatment is surgery, or because if the condition is more severe, then the only option is tendon transfer and wrist arthrodesis.